The idea behind the origin of BrainTrack came from consultation from Dementia Australia with consumers, people with lived experience and healthcare providers, and identified a need for an app for people to self-monitor their cognition. And they approached Deakin to develop the app and to be involved in the refinement and release and assessment of the usability. So by the time most people reach a diagnosis of dementia, 1 in 5 people will already be in moderate to severe stages of the disease, and this limits possible intervention and early treatment options. So BrainTrack fills a gap which enables earlier conversations around brain health, and it empowers people to take control of their own brain health by monitoring their own cognition.
Dementia Australia has been working with Deakin University for over 10 years now. We started having a conversation about, could we use games to gamify cognitive testing? So working with Helen Macpherson in showing the industry that these tools are not just fun. It's not just about getting online and playing a game. It's about getting online, using something which people are not threatened by, are engaged by, and then having substantial results that we can actually use to encourage better health outcomes. And I think that's what Helen and her team has really helped us with, which we're really grateful for. And I think this comes back to the great value I place in the relationship between Deakin and Dementia Australia. Without that respect for each other and respect for each other's knowledge, we wouldn't have the success we have today.
The reason this has been such a successful partnership between Dementia Australia and Deakin University is that Dementia Australia really understands the needs of older people at risk of and living with dementia and have developed BrainTrack accordingly. And Deakin University has provided the means to develop the app, refine it, and look at the real-world usability and impact of the app. The impact of BrainTrack in the community has been incredibly positive, and older people using the app have felt empowered to take control of their brain health. Healthcare providers have been really receptive to the app and also encouraging of the idea that it helps initiate conversations around BrainTrack and earlier diagnosis. So overall, we can see benefits already in the community based on the release of this app.